Okay. Hi, Dana. How are you?
Hey, Alyssa, I'm doing well. How are you today?
Good. I'm really excited for this topic today. So today we're talking about acupressure as it relates to our, of course, topic of the month, right? Pain and inflammation. And
Yes.
I think this is really cool because acupressure is something that you can do yourself, right?
You can do yourself. You can do it at home. It's easy to do. People like the idea of being able to kind of like, oh, this is kind of cool, and it feels this way, and then I feel that way after I kind of do it. So it's a good kind of do it at home kind of thing for just pain, inflammation, not feeling great, that kind of thing. Even colds and flus
Yeah.
and all that. Yeah.
Because it helps move kind of what we've been talking about, right? It helps to move energy through the body.
Moving energy, it's decreasing kind of that stagnation again, which we talked about, which is a big part of inflammation, is that stagnation. So moving blood, moving energy, really kind of getting the body kind of more energized and okay, like, yeah, wake up a little bit. This is kind of what we need to do and get things recircuited.
Awesome. Awesome. I see we have a couple people watching live. Welcome, Ekta. Welcome, Sandy. Let us know if you have any questions as we get going.
Absolutely.
So, and then Dana, bringing it back to one thing I think we talked about when we did tapping a few weeks ago, which is still awesome, and I can't wait to learn more about that. But I remember you saying that tapping is kind of like helps emotions, and acupressure kind of helps more like the physical stuff, right?
Yeah, I mean, if we're going to separate it like that, I mean, I'd like to say that tapping is really good because it's emotional freedom technique, right? But again, Alyssa, we're not going to separate body and mind. So if you're not feeling well emotionally, or you're not feeling your best, you're not feeling up to par, by tapping and getting those emotions kind of, yourself feeling better, ultimately you're going to physically feel better. So acupressure, we're not going to separate them, but technically emotion freedom technique, EFT, also tapping, kind of same type of thing. That's kind of what we're doing. And then with acupressure, yeah, of course, there are points that we can press, to kind of, help with, just feeling better and feeling more upbeat and all of that. But really, it's a little bit more kind of an internal kind of thing with medicine and inflammation and pain and working musculoskeletal internal stuff. Where tapping is, dealing with some emotions that are maybe, things that are on your mind.
Great. Thank you for linking them back together, right? Because they, like you said, it's not necessarily separate, right? Which I think is huge. Yeah.
Absolutely.
So as we talk about acupressure for pain management, like one thing that we talked about, Christine and I talked about earlier this week, was we talked about lower back pain. And, as obviously the three of us were going to be doing a lower back pain workshop at the end of this month, being that is one of the top 2 chronic pain complaint areas.
Right.
In terms of acupressure points, can you tell me a little bit about how those are there certain points for certain body parts, or like how does that work?
Yeah, I mean, specifically for back pain, there's tons of different acupuncture points that we can use. If we look at it in a little bit more depth, if we're using the balance method, for example, which is what I like to do, it's not a one size fits all. So what we have to do is we have to treat the channel. Where is the back pain, right? So if it's more on the side of the body, in the flank area, kind of going into the back, is it really directly in the back? What channel is that pain on? So first we look at the channel, and then what we're going to do is we're going to look at what channel balances the 6th channel. So then that determines the point that you'll use. So there's, specific points, bladder 62, small intestine 3. We know that that's a good combination for back pain. Technically, textbook, it is. However, if we're going to get deeper into it, it may not be. So
it's going to vary depending on the person.
At home, it kind of is more geared toward specifically where's your pain. And so when I see my patients, I will literally say, with one finger, I want you to point, where's your pain? And then, oh, it's all over here. Okay, now let's kind of zone in on that. With one finger, if you can, where's the pain? So I determine exactly where that pain is. It's very specific. And then we kind of go out from there and we expand it. So there are points, textbook points, that are like, okay, that's good for back pain. Again, as we get more specific, it may not work because it may not be the channel that balances the sick channel. So
that makes a lot of sense.
In more depth, you know, there's textbook points that are like, yeah, back pain. And, you know, if it happens to be that your back pain is on that channel, then that channel will balance, you know, it's going to help. So it's a little bit more specific, but there are certainly things that you can do and try at home for sure.
Cool. Okay. And that makes a lot of sense, right? Because even in terms of exercises and stretches that we can be doing for back pain, yes, there are these are the good muscles to strengthen and stretch, yet depending on your particular problem, these may not be the ones that are actually going to help.
Exactly.
Yeah.
Exactly.
Well, and I think that's really important to know, because as we start to introduce these things to people, I think it's good for everybody to kind of know right from the get-go that if this isn't working, these could be some of the reasons why, right?
And that's the thing.
Yeah.
That's the thing. I mean, not everybody does the balance method. I use the balance method every time I treat someone. And so what we're doing is we're identifying the sick meridian, and we're choosing the meridian that corresponds to that meridian that we know will treat that meridian. So, that's a little bit different from necessarily something called, what we know as TCM, which is, okay, we learned at school that this point is good for back pain. That's really broad to say. And again, could there be some benefit to it? Yes. But a lot of times people will say, I tried it and it didn't work. That could be one reason why. There's other reasons, of course, too. But yeah, I mean, to keep it simple, there are certain things you can do at home. And it may not even be, something that's specific for back pain. But if you're pressing points at home that we know are good for inflammation and going to move the lymph fluid and move the blood and move the chi, indirectly, is that going to help your back? Possibly, yes.
Possibly, yes. Especially if in combination with some of the other stuff we've been talking about so far, right? Yes. Especially if you're strengthening the adductors, strengthening the glutes, stretching, right?
Absolutely.
Focusing on your gut health, eating well. Yeah. So I think that's important too.
It's like the whole, package of,
it is.
tricks, get it all in there and apply it.
Yeah. And it's okay if not, but just curious, is there an acupressure point or two that you can leave us with today that maybe we can try at home? Like, is that possible?
Yeah, we can do some points. Let's start with, there's a couple of points here that I have in mind. And one is on if you take your arm and you kind of bend your elbow. I don't know if you guys can see me. Maybe this way is better. Yes,
perfect.
Okay, so if we're bending our elbow, kind of making, like this. So if you come out to the outside here on the lateral side between the lateral epicondyle here and then the crease, you'll see in between, you'll see where that line is kind of at the very end of your elbow crease. If you press on that, it may be a little tender. That's a large intestine 11 point, and that's a really, really good.
So if the crease is here, am I going out a little bit, like right here?
Going out to the very end. You got it.
Got it. Okay. And there it is. Okay.
So if you press on that really is a very, very good point. It's used often in treatment for a lot of different things, but it's really, really good for moving the lymph fluid and getting that moving and kind of.
How long do we hold it for?
I would say you want to hold it for, press down, and you're going to feel it's tender. It's tender on most people. It's tender on me too. I mean, it's really tender on me. So I would say, I don't know. I mean, you could be sitting there watching TV and just kind of, to kind of work your way into it. You're pressing a little harder. You're really feeling that chi, because that sensation is really another thing we call it is an ashi. Could it be an ashi point, which is a tender spot? It's tender on me. It's going to be tender on most people. So, you could just be sitting kind of watching TV or whatever at night and press it. Just keep kind of rubbing that area for a couple of minutes. The other point that's really good is on your hand, between the thumb and the index finger. If you take your index finger and you run along that bone there, that metacarpal, between the thumb and the index finger, it's a V. If you go to the very, very end of that, as far as you can go, right off the bone,
like right here,
down a little further, Yep, right
Oh,
and press.
okay. I felt that one right away too.
That's
So
an
is it
amazing.
one hand, or do I want to do like two like this, like with the thumb as well, or just one finger?
I just do on top with my thumb. I take my thumb and I just jam it in there.
Oh my God. Wow.
And I mean,
Yeah.
it's,
Are you guys
I
doing
mean,
this that are watching? I want to know how you're feeling. Okay. All right. Ava felt the
do we
first
have
one.
people, do we have people with us here
We
that
do,
are,
yeah.
oh, good. Hi, everyone. So these are a couple of points that are really good, used very often.
Yeah.
This one specifically, really just low back pain, kind of near that, you know, SI joint, kind of traveling a little bit, not so much for sciatic pain, but kind of right local, low back, you know, L4, you know, SI area, really sore in there too. So for most people.
Yeah. Oh,
But
Sandy can feel
very
it.
good point.
Nice. Two questions. One, what is this Meridian channel called that we're tapping into when we press on this point?
So this
Which one is that?
Large intestine.
Okay.
That's the large intestine channel. And then this is also the large intestine channel. This one that we're doing here, it's not an actual, it's an extra point. So it's not a point that we name specifically on the channel. So it can be used as an Ashi point, which is, you know, a lot of times if my patients come in and I'll say, you know, we're working on low back, which is almost all the time,
right,
to support the lower back. Anyway, you got to support the back for the kidneys. So, you know, I'll press around and it's really more kind of in that where the two bones come together, kind of deep in there. It's always tender. So I'll say, is that tender? You know, I'll move around a little bit, and we always use that point. That's a really good point to kind of disperse stagnation for low back pain and support that.
Yeah, awesome. One more question before we part ways here. Would I want to do these on both sides of the body, or actually, let me ask this one question first. Does it relate? Does it matter? Like, let's say my problem, because mine is on my SI joint on my right side. Is there a difference if I'm doing these points on my right side or my left side? Does it matter?
That's a really, really good question. And again, depending on the balance method and what method we use, there's 4 or 5 systems. Depending on what system we use, we would determine which side to use, because some points you can use on the same side of the pain and other points you use on the opposite side of the pain, depending on the system. To make it easy across the board, what we like to do is always the opposite side of your pain.
That makes sense.
That's kind of the general rule. There are exceptions to it, but I would say if you have pain on the right side, use your left side. If you have pain on the right, use your left. That's kind of, you know, a general rule of thumb.
Awesome.
Yeah. And of course, you know, you're doing this at home, so you can just play around and do, you know, try both sides. Typically what I do is I'll try both sides on my patients, just palpating. Whichever side is more tender is the side I needle.
Yes.
So, you know, feel around, and you may say, oh, wow, you know, interestingly enough, my pain is on the right side, and try it on both sides. And you may find, yeah, it is more tender on the right side.
Well, I'm doing this one. It's definitely more tender on my left side than my right. And again, the right side is where my problem is. So that's interesting. Oh my gosh. Wow. Another amazing tool for the toolbox. I'm so pumped about this.
Yeah, everybody in the toolbox. I know, I love all these
toolbox. Get it in there. And this is why I'm so excited that, because, you know, this is so general, right? We're giving general information, general tips, but the workshop is going to be great because it's going to be a small group. We're limiting how many people can sign up because we want everybody to have some kind of one-on-one attention with this. You know, we want to be, like Dana said, like, depending on what side you're feeling it, depending on, you know, everything else going on, you know, we can be a little bit more specific with some of these things. So this is just kind of a little intro, and we really appreciate it. Oh, good. Everybody's testing it out. I can feel it. My pain is on my right. Yeah, more and more tender on my right. On her right. Interesting. Yeah.
Interesting. And sometimes that happens, and that's not, you know, and that could be, you know, depending on what system that is, that could apply. So typically though, you know, in general, we always do the opposite side, but yeah, just feel around, guys, and see, you know, it's more tender on this side, and just go for it, and whatever, you know, and just press away, and you'll feel it's after a while, you know, you say, oh yeah, I have to stop because that's like really sore. So, but it's good.
Cool. Very cool. Awesome. Well, everybody watching, drop comments, let us know your questions, let us know how this felt for you. And please help us spread the word on the awareness that we're building this month for pain and inflammation, alternative methods, holistic tools, some new information. Knowledge is power, right? So make sure you like this video and share it. That would help us out tremendously.
Yes, that would
So
be fantastic.
yeah, have a great rest of your Friday and weekend, everybody. And we'll see you all next week.
Yeah, sounds good. Take care, everybody. Thanks, Alyssa.
Tina.
Good to see you.